Because 3 or 4 years down the line, everyone's going to forget that doctors did this, where they need not have done this. The saddest part is all these people who sacrificed their lives, they could have just backed off and said, look, I'm just going to be home and not work. And once this pandemic gets over, I'm going to start earning again, because look, none of them needed to work for money.
So hi guys, and today we have a very special guest, Dr. Arjun, a junior resident at KMC Manipal. Thank you for joining.
Thank you, Shivam. The pleasure is all mine.
So COVID has affected the life of every individual, but how many times have we spoken about the difference this virus has created in the life of the doctors who have been the life saviors during this health crisis? They are the ones who had to take up the viral exposure, risk their lives to save others. Now this will be the first time we will have a talk about the lives of the life saviors, the doctors. So let's begin. Firstly, how much impact has COVID brought in the life of the doctors?
Doctors essentially had to take the first bullet during the virus. I will not just restrict this talk to doctors. That would be unfair to the other healthcare workers who have sacrificed just as much as us and who have put just as much as we have at stake. So everyone, starting from the nurses to paramedical staff to every single healthcare worker out there, without whom our job and our sacrifices during the pandemic remain incomplete. So I would like to respect them and say that their job is no less than ours. So for all of us, it's been a very difficult last 1.5 years. And the kind of support we got in return from the government was really shocking. I mean, we had people bang utensils for us, go to the balconies, do that, take selfies. But when it came to actually supporting us with infrastructure and giving us basic PPE to work with, it was an appalling response. And so many of my colleagues and so many of my seniors have lost their lives in this pandemic, and it is so sad because not a lot of them will be remembered. I mean, the Kargil war heroes had a movie made about them, and rightly so. But so many of these doctors who lost their lives, they'll not have any movies made about them. People will not remember the names. But I think the sacrifice is, just as big as anyone else's for this country.
Yes, the sacrifice is really big, and that's why I would like you to answer this. That could you tell us about the sacrifices made by the doctors during this pandemic, which has now been over 1.5 years?
So, according to a recent estimate, only in the second wave, over 730 Indian doctors have lost their lives. You might think that it's not a very big number, but if you look at the number of doctors who are actively practicing out there, that's a huge number. Almost every single doctor that I know has known some friend or some colleague of theirs who has either been very sick because of this or has died because of this. And the sad part is the government has not come up with any kind of compensation for their families. There's not even a registry. If you want to look up and find the names of the doctors who have died because of this pandemic, you will not find it on the internet. So that's why the NGO that I'm a part of, we came up with this initiative called The Final Eulogy, where we try to remember the names of the people who have lost their lives. Because 3 or 4 years down the line, everyone's going to forget that doctors did this, where they need not have done this. The saddest part is all these people who sacrificed their lives, they could have just backed off and said, look, I'm just going to be home and not work. And once this pandemic gets over, I'm going to start earning again, because look, none of them needed to work for money. That wasn't the issue with any of them. So they worked because they genuinely wanted to help society out. And they ended up taking a bullet for society. And the saddest part is doctors are back to being the villains now that the pandemic is kind of sorted. People are back to beating us up and, saying that all we do is work for money. And that's just really sad. So that was the whole idea of the initiative that we took. But it's a constant fight, and it's just really sad.
But it's wonderful to see that the doctors have so much courage to risk their lives. But how do the doctors get this much amount of courage, risking their own life to save a stranger's life?
So I wouldn't say it's courage. I would just say that it's more of selflessness that I see from people around me. I feel the selflessness is instilled from people that we work under. So when you see your seniors and your teachers do these acts where they do not really care much about themselves, they put the patient above their own self and their own families, you are automatically driven to do the same thing. So when people did this, when they put their foot forward and they jumped into the pandemic to help others, the saddest part was that they were not only putting their own lives at stake, which a lot of us were okay with doing, but they were also putting the lives of their families at stake. And a lot of my friends were living with their parents or with their grandparents, and they actually couldn't go back home to them, so they had to go live separately, and they were in constant fear of transmitting the virus back to their family. So they had to, during this whole pandemic, they couldn't stay close to their pandemic because they wanted to continue working and helping people, and they didn't want to risk the lives of their family at the same time. So it was just an extremely difficult period for us, and hopefully the worst is over, but you never know when the third wave is going to come. But I feel that everything that's been put, all the work that has been put and all the sacrifices that have been made, it is just forgotten in a whiff, and it's like none of that ever happened.
Yeah, that's one of the biggest reasons, like, we should have more conversations on this topic about the sacrifices which the doctors have made, the doctors who have lost their lives, like, risk their family's life to save others. Like, it's a big thing. And like, I want the people to know that how was the life of an on-duty doctor during the first wave, like when there was so much of uncertainty about the virus.
So it was extremely difficult, both physically and mentally because you're scared for not just yourself but your family. So when you're in those PPEs, it's like a different world. You are secluded from everyone, and this constant fear of getting exposed, this paranoia about the virus, what the virus might do to you, both in the short term and long term, was rampant then. So it was extremely scary. And let me tell you, the PPEs are just living hell, because you will end up rebreathing everything that you expire. So your carbon dioxide levels will keep getting built up, and you'll start having headaches. You'll start getting extremely irritable in those PPEs. You will sweat a lot. It'll be extremely hot in them, but of course you'll be reabsorbing all your sweat. And it is really difficult to work in them. And the worst part is that you cannot pee at all while you're wearing them. So if you're wearing them in a 12-hour shift, you cannot drink much water, because of course you can't. If you have to pee, you have to take them off. So you can't really pee, because you can't really take off a PPE kit and then reuse another one, because the money that those PPE kits are being bought with is being provided by the government or is being taken from patients, and each PPE kit costs a lot of money, so you can't just keep using them. If you wear one, you have to wear it throughout your shift. So that is very difficult time. Slowly as we started understanding the virus and as the cases started coming down from the first wave, it became easier. We kind of got more and more used to wearing them. We kind of got more and more used to being comfortable in the PPEs, if I can say so. But those initial 2 to 3 months was extremely difficult for all of us.
Okay, so the doctors have to face a really lot and put up so much of hard work. But then at the end, what brings happiness to a doctor?
What brings happiness is not the paycheck that goes into our pocket as people think it does. But I would say when you go to sleep, it is knowing that you brought an impact in someone's life. I won't be cliched and say that what brings happiness to us is our patient's happiness. I won't be that cliched. But what I'll say is that this sense of satisfaction, knowing that you've done something very, very productive with your day, when you're on your bed and you're about to fall asleep, knowing that you've made a massive impact in someone's life, and probably no other profession can go to bed saying the same. So that for me is good enough to keep driving us to do what we do.
Okay. And in today's world, in our country, as we have seen, that there are a lot of doctors who have lost their lives due to COVID. And then the safety of the doctors is also a big concern nowadays. So, what do you think, in your opinion, that the society could do as a whole, something for the doctors?
So, according to a recent study by the IMA, 70% of doctors have said that they have encountered some kind of violent act in the workplace, which is a crazy number. if you think of it. And if I can just ask you, I just told you 730 doctors have lost their lives during the pandemic. How many politicians do you think in our country lost their lives during the pandemic? How many do you think the number is? The number is 0. So that's absolutely shocking. And yet, sadly, what all these politicians keep doing is somehow they keep painting doctors as the enemy of the public. Doctors are not a vote bank. So, what we think of politicians don't really matter to us. And painting us as the villains to public is very easy, because the public forgets very easily. So even during the pandemic, people were saying things like, oh, doctors are heroes and doctors are, doing so much, but their opinion of us is going to change very quickly. Like now that there's no pandemic around, doctors are again going to go back to being these villains and these greedy people who just want to fill their pocket. Somehow that's the perception society has about us. So somehow I feel that society has to move this perception about us either as gods or as villains to just regular people who are trying to do their job. Yes, we mess up sometimes, and when we do mess up, it has an impact on our patient's life. I accept that. I accept that our mistakes have bigger consequences than the mistakes of other people. But saying that, no doctor that I have ever known has ever made a mistake willingly, and all of us are always trying to learn from our mistakes, and violence is never the solution to anything. So even in the heat of the moment, if you feel that your doctor is responsible for causing death or something serious to someone you love, I understand why you might feel angry, but that is no excuse for taking the law into your own hands. So I would like to request people to start thinking of us as regular human beings, as people who also have families, as people who also have to take our families to the emergencies, and as people who probably have experienced this similar feeling of grief and anger that you guys have. So that's what I'd like to, that's a message I'd like to send. We're just regular people who do regular things. We watch sports and we Netflix and chill, and we go out drinking on weekends. So we're just people like you and like the rest of you. So stop glorifying us, but stop demeaning us.
Yeah, definitely. The society must listen to these golden words of yours and understand this entire thing. I really want the society to understand this, especially the masses out who don't actually think before acting this way, harming a doctor this way, especially what has happened during the last 1 year. The doctors have done so much, and in return, the safety of the doctors has become such a big concern. So that's something really bad, and your organization is doing a really good job in spreading medical awareness. I really appreciate that, and you guys have a wonderful page. So to all the audience who are listening to this part, please do and go and have a watch to their page. They are doing some really wonderful work and are playing a very big role in medical awareness. So that's it for now, guys, and thank you, Dr. Arjun. It was wonderful having you.
Thank you, Shivam. Thank you for sharing my story, and thank you for letting me be a part of your channel. I just want to say you're doing a great work in spreading awareness, about the medical community and about doctors. And thank you for standing up for us in this video and helping me, reach out to people with my word. So I'm very grateful to you, and it was a great experience doing this with you.
Pleasure's on mine.